I'm Dr. Erica Bove, and welcome to the Love and Science podcast. I'm your host, and also the founder of Love and Science, Thriving Through Infertility. I'm so excited you're here today. With over a decade of experience helping thousands of women just like you, I empower professional women to build their families with confidence and compassion. Let's dive in. Hello, my loves, and welcome back to the Love and Science podcast. I have an amazing guest today. Her name is Dr. Angela Potter, and she is a PCOS expert. I'll get a little bit more into her credentials, but I'm so grateful for the conversation we're about to have. So Dr. Angela Potter is on a mission to help women with PCOS have the best possible chance at pregnancy. And I mean, we know that when we look at sort of the landscape of women with infertility, PCOS makes up a huge percentage of people with infertility. And I also think that I think a lot of people are not diagnosed who should be diagnosed. And so we can get into that too. She is an integrative fertility doctor, a nutritionist, and a leading expert in PCOS. She's the creator of the PCOS Fertility Protocol, which helps women with an individualized approach to get regular periods, consistent ovulation, and the best chance at getting pregnant. And, you know, I was actually on her podcast last week, which is so exciting. And we also talked about advanced fertility methods and things, and, you know, where everything kind of has its place. So Dr. Potter, it's so wonderful to have you here. Thank you for being a guest on the podcast.
Oh, thank you so much, Dr. Erica. It's just such a pleasure to be here.
Yay. And okay, so tell me a little bit about your journey into focusing specifically on PCOS in your practice.
Yes. Well, in school, I did a midwifery certificate. I was always just really in love with women's hormones and this life, this whole life stages, right? Different fertility and pregnancy, postpartum, menopause. And back at that time, when I first got out of school, I was just doing more generalized women's health practice. And more women with PCOS were coming to see me. And I would hear things like that, like they would say, Dr. Potter, I have been to this other doctor and they told me, I got on a couple medicated cycles, those didn't work. They told me that there's nothing else that I can do. And I'm wondering if there is something. I'm still looking for answers before I go to IVF. Could you help me? And so I said, well, sure. And just started working with them and started seeing these results. Well, they were the ones seeing the results, right? They were getting regular periods. They were getting their ovulation back and they were getting pregnant naturally. Some certainly still needed some medications, but they were just seeing these results that they were looking for. And that's when I realized, oh my gosh, there is such a strong need here. These women with PCOS, for some reason, they aren't getting the answers that they're looking for, which is leaving them feeling broken and lost and like it's their fault that they aren't able to get pregnant. And so that's what just really steered my practice in that direction, to help these women to really understand what's going on in their bodies first and foremost, and then get that plan that is helping their bodies come back to a regular rhythm where their fertility is at its prime.
That's so interesting. So tell me a little bit about, let's talk about PCOS. If the listener does not understand how we get to the diagnosis, let's start there. And then I'd love to then move into some of the insights that you found helping people with these problems. So let's talk about, how do we diagnose PCOS?
Great. Yes. So PCOS is it's a syndrome. So multiple things make up the diagnosis. And specifically, there's 3 diagnostic pillars, and somebody needs to fit into 2 out of 3 of those in order to be diagnosed. And so we look at cysts on the ovaries, typically through an ultrasound. And that surprises a lot of people to find out that polycystic ovarian syndrome, you don't have to have cysts on the ovaries in order to be diagnosed. So that's only one of the diagnostic pillars. You could have the other 2 instead of the cysts. And then we look at the elevated androgen hormones. Those are our male pattern hormones. Testosterone is the most well-known one. And when that's elevated in a body of someone who has female organs, then that's shutting down ovulation and contributing to a lot of the classic PCOS symptoms like hair growth, like the chin hair growth, acne, extra weight gain, things like that. And
Mm-hmm.
then the third pillar is ovulation issues. And so this can be diagnosed through testing. It can also just be talking with your doctor and saying, like, hey, I haven't had a period in over a year. That's pretty clear that you're having ovulation
Mm-hmm.
issues. Irregular cycles can fit into that. If you are testing for ovulation and you're not getting any positive tests, so that would fit into that ovulation issues. And so again, if you fit into 2 out of 3 of those, then you're diagnosed with PCOS.
Yes, thank you so much for clarifying. And there's also some tests. I always say we got to cross off the lookalikes too, like the thyroid and the prolactin and all those things. So a lot of
Yes.
people come to me, and I'm sure you see this too, and they've not had any evaluation, but maybe they're on the heavier side or whatever. And people are like, oh, you have PCOS. Or, also I do a lot of second opinions. People come to me and say, well, I just have unexplained infertility. Everything is normal, but their AMH is like 8, and they're, like maybe they have had intermittently irregular cycles, but right now they're regular. And so I do think there's this thing about like, yes, I understand we have this like Rotterdam criteria for the PCOS diagnosis, but I also have expanded my mindset to say, okay, are you on the PCOS spectrum? Like maybe you don't like rule in entirely based on these criteria, but I have helped so many women who didn't meet the full criteria, but like my spidey senses got up, after all the like listening to them, and oh, my mom needed Clomid to conceive. Oh, that's very interesting, 30 years ago. And you just start to say, okay, well, what if I were to treat you as if you have this, and think about it that way, because there's so many, it's not like all of a sudden somebody develops PCOS, right? It's a genetic predisposition, and there's many different
Mhm.
pathways, but I think, it's really important to diagnose the people who have it and really rule out when it's not there, but then also have this expanded view of people who are on the PCOS spectrum. I find that very, very useful in my practice.
Yeah, I'm glad you bring that up because
Yeah,
PCOS as a syndrome, for many years now, there's like the medical research behind it. One, there needs to be more research, and
totally.
two, there are organizations that are really trying to push for a better understanding of what the condition really is, to be able to communicate that. There's even initiatives out there to change the name so it's that much more specific. And
Right.
so, yeah, PCOS has this, there's a little bit of confusion behind it. And so I absolutely agree with you that we've
Mhm.
got to look at the person who's sitting in front of us and
Yes.
really understand that picture. And yes, have that criteria, of course,
Yeah.
but also who is this person? What's going on? And ultimately, what can be that bridge from where they are to where they want to be.
Yeah, absolutely. And I will say, I mean, I do like full spectrum, fertility care. I've never met somebody who like truly wanted to go through IVF. Like somebody said,
Oh,
I
yeah.
met my partner, just sign me right up for IVF. That sounds amazing. Like nobody ever says that because there's a financial
Right.
toll, there's an emotional toll. It's not without
Mhm.
risk. And I think that most people, if they could choose it off a menu, would say, no, I want to either get pregnant like in the comfort of my home, right? Or if maybe somebody needs donor sperm, just like a little insemination and like the least intervention possible. I'm here for full intervention if that's what people need, but that's most people, that's not their preference. And so tell me what you were finding in that early part of your career where you were able to help people who had basically been told that they couldn't be helped or that they needed more advanced therapies.
Yeah, well, so, that really fits into these misconceptions out there about PCOS. And a really big one is that, you can't get pregnant on your own with PCOS. You're going to have to either use medications like the medicated cycles or go through IVF.
Mm-hmm.
And I'm not finding that in my practice. Certainly, those are tools, and I love that we live in an age where those tools are available. But what I see is they're not being used at the right time in the process. And so, a few minutes ago, you mentioned like there are these women saying, "Oh, everything's fine on my labs," and I think that speaks to something really big foundationally that I was finding with these women is that they were saying things like that. Like, my doctor doesn't know how to help me. They're telling me my labs are fine. And from my perspective, when I have someone in front of me who is saying, my periods come every 75 days, or I haven't had a period in the last year, or I'm not getting any positive ovulation tests, to me, that story does not mean that that person is broken or
Mhm.
can't be helped. To me, I put on my detective hat and I say, gosh, like your body wants to get back into its natural rhythm. Like as females, as people who have female organs, that is just natural, our body's natural resting place in, this time frame of our lives is to have a period roughly every 28 to 30 days, have
Mhm.
ovulation most every cycles. That's when our body is feeling at its best. Like, and not even at its best, just normal and like functioning as it's supposed to. And so when
Mhm.
I have someone in front of me who's saying, well, I haven't had a period since, last March, and that was 6 months ago. What can I do? So it's all about figuring out what the barriers are to getting that person back to their natural resting place.
Mhm.
And so I do that through a variety of things. I was a nutritionist first before a doctor, so I use a lot of nutrition. I'll use supplements. I'll help them get really specific into what other systems of their body are contributing to their not being able to ovulate or not having a regular period, and to take those barriers away to see how far can we get. And usually that person can start ovulating regularly, can start having a regular period. And sometimes because PCOS has so many different elements to it, it's not that
Mhm.
just, okay, this one enzyme process is broken, so we can fix that one process, right? No, as we talked about with the diagnosis, PCOS is slightly complicated. And
Mhm.
so sometimes then at that point, when that person is seeing these great response, like getting their periods back regularly, then sometimes they might need that medicated cycle just to like give them that push over the
Mhm.
edge.
Mhm.
But it's really about uncovering, okay, what is it in the body that's keeping the body from doing what it's naturally meant to do?
Yeah, and I'm so glad you brought that up. Like, kind of what are we designed to do? And I always say, why does PCOS exist? It probably exists because the ancestors of the people with PCOS today were the survivors in the famines, and they were very, very. It's kind of like the type 2 diabetes hypothesis. It's a lot of the same genes. Like, yes, there would be long periods of time when there was not enough food, and it was the people who could conserve that energy and who could fire it off an ovulation once every 4 months. Like those were the people who were able to sustain the species. It sounds a little strange, but that, I really do believe in that. Like that's why it exists. And at least in this part of the world, like we don't live in a famine for most places. And I know some people have scarcity, but it's a different environment. And so if we think about like, how is it to live with those genes in the society today, and have these sort of no food, no abundant food, low quality food, all of those things, it's a recipe for PCOS to really go off the rails.
Mhm.
Yeah. Yeah.
Yes. Yeah.
And, also you mentioned like, what does the body, why are we designed this way? Yes, reproduction is a huge part of it because we are designed to keep the species going. However, I think about like the broader picture, like you said, the other body systems, like, oh, guess what? Our bones like estrogen. Like our bones like, having enough estrogen around. Our heart likes to have estrogen around. Our metabolism likes to be functioning in a certain way without insulin resistance. Our uterus likes regular exposure to progesterone so that those cells don't go rogue. And so if we think about it in a broader sense of like, yes, reproduction, of course, that's really important, but then also like the whole rest of the processes, like it is optimal to be going through these cycles every month for our bodies to be as healthy as possible. And I understand, people do go on birth control pills for various reasons. I'm not opposed to that, but if people
Absolutely.
are truly trying to be in their fertile window and they want to restore natural cycles, I think there's a lot more tools than we realize.
Yes. And another big misconception or mistake that the medical community is making these women believe is that we just have to focus on the ovaries and the uterus in order to get them to that outcome, the getting
Mm,
pregnant outcome. And that, in my opinion, and what I see, is not right. And it's actually leading so many women in the opposite direction
Mm-hmm.
because if they are, let's say somebody who's been trying for a year, is having irregular cycles, and goes in to see their doctor after a year of trying. And that doctor is saying, okay, well, since you fit into PCOS, let's get you on these medicated cycles. I'll give you 5 rounds. And then if those don't work, IVF is next. Like that's typically for
Mm-hmm.
conventional medicine, the path. And if that woman is starting those cycles and she is having something going on with her gut health. Like she's had
Yep.
years where she's had bloating and gas and constipation and just thinks it's normal because, just that, and goes into those cycles.
Mm-hmm.
And that doctor isn't looking at these other systems in the body to see how that's contributing to inflammation or
Mm-hmm.
hormones not being as they are supposed to. Well, then that poor woman is going in without the highest rates of success
Mm-hmm.
because she's just going in with all these other systems kind of sluggishly moving along. And is
Mm-hmm.
her body ready for pregnancy? In my
Right.
opinion, getting her to a place where, okay, her gut health is identified and supported, and then seeing how that helps. And then at that point, having the discussion like, okay, do you want to try naturally for a little while, or are you ready for some medications or a procedure?
100%. And I think, okay, so best case scenario, that woman goes to a conventional REI doctor and gets pregnant, but still has all the gut health issues and still has the bloating and the constipation. And now she's pregnant and has to deal with these things. I mean, I'll also say, Dr. Angela, I know you know this data, but I'm going to say for the listeners, like people with PCOS have a higher rate of miscarriages. And that we say, oh, we tend to like, fat shame and as a society and even as our medical culture, that
Mhm.
extends to lean PCOS as well. Why is that?
Absolutely.
Looking at obstructive sleep apnea. Why is it that people with lean PCOS have more obstructive sleep apnea? Guess what? Eggs and embryos and pregnancies, they like oxygen. And so I think we do have to take a deeper look to like optimize somebody. And I mean, there's nothing harder. And I do this a lot of times, I will talk to patients and say, hey, I can give you the letrozole. We can try and do some health optimization. I'm pretty good at it by now, but it's a pretty hard sell to say, like, let's invest 3 to 6 months in your, health first. And I say, hey, you might not even need anything beyond that. Like, I'm not convinced you need therapy, but, I love it when people take me up on that because I often do see people conceive during that window. And, it's like this push, 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 like, well, I want 3 kids and I'm 35 or whatever else. Like, it's like we get into this scarcity mindset. And sometimes we need to slow the process down to look at the root causes. There's nothing worse than meeting with somebody after 4 or 5 cycles of letrozole being like, I think your weight might be contributing or your inflammation might be contributing. Let's go back to the drawing board. I mean, that's very, even IVF. Oh goodness, it looks like, you've done 2 IVF cycles and your egg quality is really terrible. Oh shoot, like let's now invest in health optimization. Like, what if we just slow the process down from the beginning? If you're listening right now and finding yourself nodding along, this is usually the moment people realize that they want support that's specific to them. In addition to this podcast, I offer one on one fertility consults where we look at your full picture with both strategy and compassion. You can learn more in the show notes. Now, let's get back to the conversation.
Yes. And absolutely, for somebody who has been on this fertility journey for a year, five
Mm,
years, 10 years, that's a hard conversation to
it
have,
is. It really,
right?
really, really is. Yeah.
Yeah, because 3 to 6 months in that person's mind is an eternity
Yeah.
to ours. And, but I'm on that side. Like I see that 3 to 6 month being that sweet spot for
Yep.
when things really start turning
Yeah.
over naturally, like if somebody's
Yeah.
on wanting to do it naturally. And so also, for women who it did take, let's say 6 months, when we're talking once that baby has arrived, we just reflect like, oh my gosh, can you imagine where you were this time last year and how
Yeah.
long it felt to go through that process of optimizing your body and just focusing on your health, taking that step back, and look where you are now. Like you're already
Yeah.
here with baby in your arms.
Yeah.
Yeah.
So this is all like so much in line with how I practice as well. Can you share a little bit more? Because I know my listeners love like really granular data, like a little bit more about, your approach to nutrition, a little bit more about your supplements, because I think people by now are probably like, oh, that's really interesting. I wonder if this more holistic approach could actually help me.
Yeah. Yeah. Okay. So, um, that's a deep dive question.
It is a
Um,
deep dive. That's what we do at Love and Science. We do not stay superficial. We go deep because our people deserve the deep. They just deserve the deep. There's so much
yes.
generic advice out there, and that's why people are still suffering. Yeah.
Yes, absolutely. So I will say, I'll get into a little bit of the process, but what I'll say, kind of looking over when I'm talking with so many women who want to see results, and usually the ones who are talking to me, they're already on a prenatal, maybe some vitamin D, CoQ10, maybe myo-inositol or avositol, and they're just confused because they're like, okay, I want to talk to you, like talking to me, like, because I feel like there's something else I could do. But at the same time, I feel like I'm trying everything.
Correct.
And
Yeah.
yeah, so I would say the biggest issue there, because any one of those supplements that I just named, you can find great research on it for fertility and PCOS. Okay.
Yeah.
But none of that, that's all surface level. They all are supportive in their way, but those are surface level supplements to help get to that root cause, particularly of hormone imbalance. Of some, if that person talking to me hasn't had a period since last March, 6 or 8 months ago, then none of those are getting to that nitty-gritty of why they don't have enough progesterone, why their egg quality is poor. Yes, CoQ10 helps with egg quality. Yes, myo-inositol helps with egg quality. But if you've been on these supplements for so long, X amount of months or years, they clearly are not the answer to
Right.
what your hormones need. And so, first off, when I'm working with nutrition, I'm helping people with an elimination diet. We're doing it a little extra with some detox, but hands down, elimination diet. And that is one of the most powerful things that somebody can do because it is once you get to the end of an elimination diet, then you do the food reintroduction. So, elimination, you're taking out the top sensitive allergenic foods. And then at the end of the month, you're reintroducing them one by one. And when you reintroduce a food that your body is sensitive to or allergic to, well, really, we're looking at sensitivities here, I'll be honest. Um, you are going to get a huge symptom response to that. Okay. It's going to be digestive issues, skin issues. I've had people who told me, oh my gosh, doc, like my back suddenly erupted in a huge red rash that I didn't know where it was coming from. And now
Mm.
I know it's the dairy or what have
Wow.
you. And so that information is one of the most powerful that you can have because it's your own body telling you. It's not a
Right.
doctor being like, here's a prescription for this medication or supplement. It's your body saying, actually, you were eating that food for a very long time and I hate it in the sense like it's not making me feel good. And that is
Hmm.
contributing to hormones being out of balance. So we're doing that, getting really in depth into how to what I call flood your body with nutrients
Hmm.
because we live in an age where how do I want to say it? Like PCOS again, like has so many different components. And what we haven't talked about is that, there's environmental elements to it.
Hmm.
We're exposed to so many toxins on a daily basis from water, from beauty products, from pesticides and food. Our soils are depleted in essential nutrients. And we live in an age where it's just not talked about a lot of how to actually get those extra nutrients back into the body in order to create this foundation. I mean, your mitochondria need antioxidants in order to protect your eggs. The
Right.
eggs, I haven't said this statistic in a while, but it's the eggs that have the highest density of mitochondria in the entire
Yeah.
body.
Yeah.
And they require all those antioxidants in order to work.
It's
And
true.
yeah. And so we do that through food. Then I'm walking someone through my PCOS fertility protocol and honestly getting them on the fertility foundations, which would be like a few of that I've mentioned, prenatal, myo-inositol, because those are really helpful. But
Mm-hmm.
then we need to get to that next step to look at other systems in the body to see, okay, is gut health contributing? And if so, what can we do in order to support that?
Mm-hmm.
What level of detox does your body need? What kind of products do you have in your house? What kind of medications have you been on in the past? And how can we clear the detox process? Because our bodies detox naturally on a daily basis, right? It's more about reducing what goes in, the toxins that go in, and then just supporting the natural system, detox system inside to keep it going.
So how
Um,
can I interrupt you for a second? How do you check
yeah.
gut health? Because I'm not, and I've heard about this before, but and maybe the listeners don't know either. What is your way of checking that?
Yeah. So I start off with a questionnaire and we just go based off of symptoms. Moving forward from there, it's highly individualized. So a lot of people, we can just use my gut health foundations, and that will help clear a lot because we live in an age where we're eating food really fast or in the car, or we're not getting adequate bacteria with our daily
Mm-hmm.
meals. So just a really quick addition of, probiotics or probiotic rich food can really help that. And then that'll turn around someone's bloating,
Mm-hmm.
constipation, whatever. But then it's going to depend on symptoms.
Sure.
So there's a variety of gut health testing out there. There's stool testing is probably the most common, but then if somebody has SIBO, that is a breath test, and you can't do a breath test along with like you're gonna get different information from a breath test versus a stool test. And
Mm-hmm.
so, and then do we need to add in H. pylori? Usually that's an add-on to a functional gut health test. So that's all going to be individualized based
Mm-hmm.
on symptoms that are going on, family history, things like that.
Mm-hmm. Okay, that makes sense. And I get this question a lot. So I hear you saying, you sort of really listen, right? You do the elimination diet, you add things back in, you allow the person's own internal body wisdom to basically tell us the answers, right? That's the magic of this is it's highly individualized, right? And then
Yes.
people always say like, what's the best PCOS diet? I mean, I don't believe in diets per se, but like what are the best ways to optimize my health when I have PCOS? Because we haven't talked a lot about this yet, but it's the weight as well. I mean, not everybody struggles with the weight part of things, but
Mhm.
I hear this like no matter what I do, I just put on 20 pounds without even thinking about it. And it's not fair. I eat well, I don't eat that much, and I have a hard time maintaining weight, and even maintaining weight is a struggle. And here it is, the weight just keeps creeping on, especially with these fertility treatments. How do you approach that piece of things, especially as it pertains to diet?
I'm so glad you mentioned that
Yeah.
because, in my opinion, again, if we get pigeonholed into the weight discussion, then like with the person sitting in front of us, that is again, not helpful for them because it's less about the actual weight piece. I know there's tons of research about how the extra pounds can contribute to ovulation issues, but we have this lean PCOS as well. And so anyway, it's more about nourishment than it is about the actual weight piece. Because if we're only focused on the weight piece, then we get people who are on low calorie diets,
Mm-hmm.
who are eating highly processed breakfast bars and low fat, high fiber, but extremely processed, hard to digest breakfast cereals. Like the list goes on,
Mm-hmm.
and completely forgetting about the nourishment piece, which means egg quality is staying low because again they're not getting those antioxidants in there, not getting the type of fiber that their body needs, not getting the protein. So it has way more to do with the nourishment piece, looking at micronutrients, looking at antioxidant levels, having a really colorful diet. Getting into the nitty-gritty. One thing I do with all of my patients and clients is have them do a food journal. And that's a really valuable session for them because they fill out for a week of what they've been eating. And particularly for people who feel like I've been eating clean, hands down, I will always find something that's going on in their day that is causing problems with their hormones. And that reminds me of one person in particular
Mhm.
who came to me, hadn't had a period in about 10 months since getting off of hormonal birth control, had like a period, two periods after getting off of that, but they were really light, and then all of a sudden they disappeared.
Mhm.
And so then came to see me months later and was saying, yeah, I eat really well. I don't know what else to do. Well, for her, she was not eating enough calories during the day, was not eating in a way that was supporting her blood sugar and her insulin. And so I was coaching her through that, how to make those changes. And
Mhm.
for her, she was adding in lots more food, which totally surprised her, and her period came back. She has had
Wow.
regular periods since, for the past 4 or 5 months. And I was checking in with her recently, and she was like, "Yeah, that food piece really blew my mind. I've actually lost some weight after we've added more food into my diet." Her husband is following a similar plan and he lost like 35 pounds. So it has, if the healthcare practitioner, like for you, the listener, if you're talking with a healthcare practitioner and they are only telling you, well, you've got to lose weight in order to start seeing your ovulation come back, that's a misnomer. And they are completely missing out on helping you nourish the body for your egg quality, missing helping you figure out, okay, what is insulin doing to your progesterone or your estrogen? So there are these other pieces. So if you are someone who tends to hold on to extra pounds or, gains weight really easily if you just eat a little bit extra, it's not your fault.
Mhm.
I see it usually from a hormonal root cause, particularly
Right.
for PCOS, and you've got to be working with a practitioner who can see that bigger picture and help you. Sure, weight loss can be part of the process, but you've got to really look at that full, complete picture.
Yeah, thank you so much for saying that. It even makes me think, even just yesterday, I got a portal message from the patient I've been working with for 2 or 3 years at this point. It's a miracle. I finally got a period. And she's somebody who actually lives in a larger body but has been undernourishing herself for years. And, just having so much compassion for that person who's trying to do the quote unquote right thing by society, but it's having the opposite effect. And so I teared up. I'm like, I'm not crying, you're crying, like I was so grateful and happy for her because her body's waking up again. But the answer, like you said, was more, better, not less.
Yes. And that's a huge, because, we get these messages from when we're young girls, right? So by the time we're 28, 33, that stuff is hardwired in the back of our
Totally.
brains. So
Totally.
it can take some time, and it can be hard. But when you really want to get to that root cause and understand, yeah, I mean, you can really see huge changes when you're focused on that quality and adding in to when it's specifically helping like your hormones rather than just being these like empty calories per se.
Totally. I wanted to also ask you a question about how you counsel people about physical activity, because I think that's also kind of an important piece. And I'm curious what you've seen in your practice.
Yeah, yeah. So I come at that from like kind of a different perspective. Physical
Yeah,
activity, of course, I am talking with everyone, but what I want them to do is focus on the sweat, because getting nice and sweaty is showing that the body, the liver is jumping into action and helping with detox, because our bodies have five main detox pathways. The air, lungs, how we're breathing, through our sweat, through our poop, through our pee. I want somebody to sweat. For many of us, sweating is not a big part of our lives. And so I want that person to be sweating. And sometimes if physical activity isn't bringing on that sweat, I still want them to be out there and to be active. But if they're not getting that sweat response, I want them in a sauna to be really activating that sweat process, to be helping
Interesting.
with that natural detox. Yeah. And
Yeah.
help with the hormones, which I see the most. And I'll add in one other thing because again, with the exercise piece, I don't have a one size fits all
Mhm.
plan because there's another side of things that I see where women are working out really, really hard, and which is actually moving them further away from having hormone balance. So, there's some good research behind the high intensity workouts for PCOS, but some women are taking that just too far.
Like
And
2 hours a day, 3 hours a day. Yeah.
yes, yes. And then not getting like that nourishment piece in.
Right. Right.
Yeah, to like with either the protein or the micronutrients that the body needs. And so it's figuring out that sweet spot of, okay, what is, what is the person doing? Are they not exercising enough? Do they need to get that sweat piece up? Or are they exercising too much and their
Hmm.
body actually needs to take a step back?
Yeah.
I was working with someone who was like she was a marathon runner. And of course, for her also the running really helped like
Of
mentally
course.
and,
Yeah.
as it does for many of us. And so then she had been told that she had HA and hypothalamic amenorrhea, and so was working with that, but just was not getting the results for that. Her periods were not returning. And so then started working with me because she had a PCOS picture. And
Hmm.
so that was the main focus of our plan, was to really help that nourishment piece of her body. And she had taken some time off of running a few months before starting to work with me. And
Hmm.
then after really getting that that re-nourishment in her body, she was able to add in a little bit of exercise here and there and could understand the signs mainly through her period because it had come back at that point when she started working with me. Um, when the period was a little bit longer, she knew she had been exercising too much. And
Hmm.
so she was able to find that fine balance. She was pregnant naturally after 5 months.
Wow.
So, yep. Yeah, it's
I
possible.
know you have, like, looking at your website, you have a tremendous track record of helping people, which I think, the people who listen to my podcast, they are interested in results. They're interested in the why and the how. But I think at the end of the day, that's all well and good if there's not the results to say, okay, this actually works. And so, go to Dr. Potter's website and look and see how many testimonials she has. Like, this is really working. And I will say, I know I don't talk a lot about it on this podcast in particular, but I am 100% aligned with what she's doing because it really does work for many people. Now, there are situations where, that approach is not enough. And PCOS, like I said, there's like we just said, actually, there's so many different pathways and so many different severities. And so if I see somebody's AMH is 23 to start out and, like the hormones are all over the place, that might be a tougher situation. Sometimes lean PCOS can be really hard to address as well. And so again, it's not a one size fits all, but the point is Dr. Potter has the results to back up what she's saying. And I want us to think about that.
Taken care of. And I will say, one thing we mentioned we were going to talk about is like, okay, what is the single most important thing that someone with PCOS could do to help their fertility? And that is after, 10 years of being in practice and seeing all these results for women with PCOS, it's to get an individualized plan.
Yep.
Because by diagnosis, PCOS does not fit into a box, and neither should your fertility treatment plan. And
Right.
yet the up to date, the conventional medical process treatment plan for someone with PCOS having infertility issues is a box. And it's just this step-by-step process. Again, those
Mm-hmm.
medicated cycles followed by IVF, which absolutely are helpful in a certain place and time. But if you haven't done that work first to understand exactly what's going on in your body, because your body is different from anyone else who's listening to this to this podcast who has PCOS, right?
Right.
Because the diagnosis is different for most women. And so you've got to get that individualized plan to really see, okay, why is it that you aren't having regular cycles? Why have you not been able to get pregnant? Really, and not just being told, well, your labs are fine. We're not sure because you can't
Yeah.
have normal labs and still have irregular cycles. That's just physiologically impossible. And get that plan that's specific to your body. And that is when you're going to see the best results. Sure, you
Yeah.
might need a medicated cycle or two. Sure, you might need to go to IVF, but getting that
Yes.
individualized support is
Yes.
hands down the number one most important thing if you want to get pregnant with PCOS.
100%. And, we talked before about investing 3 to 6 months in optimization and then moving. I have people do this stuff concurrently too. I mean, it's not like you have to,
Yeah.
stop the train, stop the train. Now we're going to look at this. Like there is a lot that we can do side by side. And I do see that as people are focusing on these things that, success rates start to improve. So, Dr. Potter, we're at time, but I just want to say thank you so much for coming on the podcast. And, what you're doing is so needed and so many people suffer because of this very limited view of PCOS. And when we can take this holistic approach and we can take this tailored approach, especially in the fertility space, I just see so many different results, and it's so beautiful. So where can people find you?
Well, thank you so much for saying that. It's such a pleasure to be here. Yeah, so I have my own podcast, which you can find Dr. Erica on. That's the PCOS Fertility Health Podcast. I'm on Instagram at Dr. Angela Potter, Facebook too, and I have my website with a blog, and it's all, I specialize in PCOS, so you're going to find all PCOS information over there, really highlighting my PCOS fertility protocol and the different steps that you can take to turn things around.
Amazing. Well, this has been so informative, and we will put all your links in the show notes. And to my listeners, like I always end, you know how much I love you. And until the next time, bye.